The following brief presentation is designed to clarify some aspects related to imaging pericardial tamponade. Firstly, pericardial tamponade is not an all or none event. There are varying degrees of impairment that will be seen with echocardiography related to the varying degrees of cardiac compression. If an effusion develops rapidly, the signs and symptoms will occur more quickly. Secondly, tamponade is not related to the size of the effusion. A relatively small effusion can cause tamponade if it develops quickly. 2D is an excellent way to identify an effusion, but evidence of tamponade includes 2D, Doppler, and importantly, clinical signs, like, for example, a significant drop in the patient's blood pressure. With echo, the 2D signs of tamponade that may be evident in ventricular systole are right atrial collapse and paradoxical ventricular septal motion. A 2D sign of tamponade that may be evident in ventricular diastole is right ventricular free wall collapse. Again, there are varying degrees of impairment that will be seen with echocardiography that are related to the varying degrees of compression. Compression of the right atrium will occur before compression of the right ventricle, as right atrial pressure or intra-right atrial pressure is less than right ventricular pressure. Doppler signs of tamponade that may be evident include diminished left ventricular filling with inspiration, increased right ventricular filling with inspiration, the excessive respiratory variation that is often greater than 25% when imaged with Doppler is likely to occur, but it may be difficult to clearly demonstrate, especially in certain acute settings. I hope that this brief presentation has helped to clarify some aspects related to imaging when pericardial tamponade is suspected.